So it looks like we got started about a minute late. Thank you for your patience. We're going to be talking about exercise today. And especially if you're over 60 and your muscles just don't react the way they used to. It's called, technically, the geek term is called anabolic resistance. Anabolic. You've heard of that with anabolic steroids. Those are the steroids that make your muscles grow. Resistance means your muscles are resisting that growth, and that starts happening to us. I had my 68th birthday a couple of weeks ago, so I'm pushing 70, and I will say this: I'm proud to say that I've got better musculature than I did 30 years ago, but it comes at a cost. I mean, I have had to have some discipline, and I've done some work. I'm still nowhere near where I need to be. Let's talk about why this is an issue. Sometimes you don't end up in a nursing home because of a heart attack. You end up there because you just couldn't get up off the toilet. That moment, it's quiet, it's embarrassing, and it's terrifying. It's how you lose your independence. So many people over age 60 lose their independence and end up in nursing homes because of muscle issues. This thing that I just mentioned, the technical geeky term, anabolic resistance. Our muscles don't want to repair. They don't want to grow like they did when we were in our 30s. It may start with an unexpected fall. I remember I was out running one time and had a fall, which it was very embarrassing. I was running with some other guys, and I didn't think much of it, but it became a major topic of the conversation. My muscles were just not responding the way they had when they were younger. And so if you don't train these muscles and continue to train them and continue to stimulate them to repair, regrow, update, you're going to be at risk for a major problem. Now, I have to add one more thing. Most people think about that when they think about muscles and aging. They don't even think about what might be the most important component of muscles, and that is that muscles are an endocrine tissue. YouTube creators love to do topics like, I might get delisted for this, or I might get banned for this. I might get somebody say, look, that's bad medicine to say muscles are endocrine tissue, but think a little bit more deeply. Muscles are really the major safety valve that we have internally as we start aging into insulin resistance. Yes, body fat's very important. It's the major internal tissue risk that you have, but muscles, metabolically active, strong muscles with good capillaries, a good place for those insulin receptors to live, and good, healthy mitochondria are the place that we burn that glucose that needs to be burned. So day to day, tiny decisions can end up shaping the next 3 decades of your life, whether you end up in a nursing home or whether you end up as a happy, healthy senior seeing those grandkids and playing basketball and going for hikes with them, and great grandkids. These decisions are simple. These exercises are simple. They're backed by science. There's plenty of evidence behind them. And more importantly, they may be the difference between aging in your home and, again, being in a nursing home. So, Jesus, you ready to join us and start talking about those exercises?
Great intro, Dr. Brewer. I wonder who wrote that for you.
I'll take all the credit. Since you liked it, I'll be happy to take that credit.
Fantastic. So, and thank you so much for joining us, guys. For those who are new to the channel or just coming back from after watching another video, just want to let you know, these are live shows, so it's more interaction between Dr. Brewer and I, more than a lecture. We're going to be discussing these 5 exercises that seniors skip or neglect in a lot of cases, and we're going to talk about why they are important. So first one is glute bridges. Have you ever done those, Dr. Brewer?
I have. I remember back when I played football on the junior varsity team, they had us do glute bridges on our helmets. I haven't done many since then, and I probably should have.
Exactly right. I know Dr. Brewer exercises a lot, but also I know Dr. Brewer is very open to learn new methods and exercises like this one, like the glute bridge, which are what we call isometric exercise, where not you're not putting too much effort into pulling and pushing, more like keeping on a single position and create that pressure on your muscles, and that helps a lot, especially for the blood pressure. It activates your nervous system. It makes your muscles stronger, especially the gluteus, the hamstrings, the core, and the lower back. And there's evidence that has suggested that when you do this type of exercises, especially the glute bridges, um, you are pulling more glucose from the bloodstream and using that more efficiently than you would do with some other exercises. So it's a simple exercise. I have found, and you correct me if I'm wrong, Dr. Brewer. Uh, I believe many people will skip this exercise because it seems like it's just too simple. What's the good on exercises like this? But the reality is that there is plenty of evidence that will suggest that this type of exercises, and the glute bridge especially, since it activates muscles from the core and on the glutes, it's very helpful. I mean, for some people, not all, but the glutes might be one of those major muscle groups as well, just like the legs, right?
Yeah, there's a lot of debate. I always thought that quads were the biggest muscle group. When you look it up on Dr. Google, and Google will say no, the glutes are. You bring up a good point, and now that I've wrestled the camera away from you, about isometrics. Isometrics were maybe, quote, discovered or rediscovered back in the 60s, 70s, and 80s, and that was a big deal. A lot of people were using them. And then a lot of exercise physiologists, a lot of trainers, a lot of bodybuilders said, no, isometrics are just not that helpful. They don't really build a lot of muscle. And isometrics are now in a rediscovery period, both for performance and especially for what you and I are talking about. I'll talk about those again in just a minute on our next exercise.
Thank you. And an additional benefit of doing some exercises for your glutes, they will increase your hip strength and reduce the risk of falling and breaking a hip. So it's very easy to just lay back on your knees, bend and your feet flat on the floor, about a hip width apart. Place your arms by your sides, press through your heels, and lift your hips. One of the major mistakes is that you lift your hips too high. It doesn't have to be that high. A little bit higher than what I have in the image, though. And squish your glutes and your abdomen at the same time and hold it right there. Uh, you can hold, if you can hold it as much as you can, at least 2 seconds, but more than that will be wonderful. And you just do a couple of reps than that and rest for 30 seconds between each repetition. I try, when I do them, I try to hold at least 15 to 30 seconds. But if you do 5-10 seconds, that's also good. It's better than not doing it.
So I'm going to try those after the show. I just did as you know, yesterday I just did my first wall squat.
Yeah, that right there.
Wall sit right there.
Wall squat. Yeah.
And I have to tell you, we've talked about them a couple of times. You know what I do? We did a video on it with the one-legged step squats and the one-legged calf raises and the clean and jerk activities that I do with weights and stuff like that. So I was being a little bit arrogant and said, you know what, wall sits are for old people, meaning somebody older and more decrepit than me, because I was in good shape. And we were preparing for this video today, and I said, you know what, I've been saying I could do a wall sit, assuming it. I need to go check that out. So I went over there, and it was a little bit more than I thought it was. At about 20 seconds, I'm thinking, I don't know that I'm going to make it through the minute. And then I started hitting that burn at 20 seconds. The burn increased. I said, well, I'll just try to make it at 30 seconds. And I know I'm in good shape. I'll probably grow into this fairly quickly. Then the burn settled down a little bit, and I did make it to a minute, but at 20 seconds, I didn't think I was going to make it.
Man, so you're in worse shape than you thought.
Well, it's a different kind of shape. Again, it took and I'm feeling in my thighs today. So it's a different kind of exercise.
You know what? When I do the wall sits, the wall squats, um, I really come into realization that I don't have the legs that I should have, and it helps me with that as well. Like you're in that position and you look at your legs and you're like, man, I really need to work on this.
And here you've been a national level soccer athlete for Mexico.
Well, I'm too old for that now. So I just want to, before we go to the wall sit and explain a little bit more on that, I want to apologize on this image because I just realized this is AI generated, so you know. But you don't need to put your elbows on the mat as you have in here. You just need to put your back flat on the surface. So I don't want to create any confusions. Just back flat on the surface. Put your hip up, bend your knees are bent, and that's it. It's easier than it looks like in here. Just wanted to clarify that. All right. So the wall sits. So just like Dr. Brewer mentioned, you just go onto the wall, and if you need to hold on into chairs or something next to you, you can do that. You can put something next to you so you don't fall, and just press on that. If you can do a full minute, that's fantastic. But if you only do just like Dr. Brewer mentioned, 15, 30 seconds, that's good as well. It's part of just getting your legs a little bit stronger. It feels uncomfortable, but it really provides some quick benefits. There's some evidence that can even lower blood pressure over 4 weeks up to 10 or 12 points, which is massive. And you just need to do maybe 2 or 3 sets whenever you're doing this training. 20, 30 seconds, that's more than enough. Any additional comments on this one?
I will say, Fred, who's our partner on the channel and in with running the clinic and the supplements program, has some experience in national level athletics, and he shared with me a website from a high performance physical trainer group that is very much involved with national level athletes. Craig, his son, was a guard, or defensive tackle for
Carolina Panthers.
The Carolina Panthers. They called him Death Row because, the images of what he did in terms of being a defensive American football tackle. So Fred was saying, look, my kids have had a lot of exposure to some of this, and there's some isometrics coming back into very high performance professional athletics. So keep your eyes open. And I have found a better image of a glute bridge and how to get there. I'll send it to you by text, or you can just look up glute bridge when you get a chance.
Yeah, thank you so much for that.
Show a better one.
You can send that to Aspen. We can just put it after this one's, and we might be able to upload that on a PDF file or something. All right, next one, chair squats. You love these ones. We did a video about that quick test that can predict longevity. How many of those you can do in about 30 seconds and or a minute, and this is a predictor of mortality. And this is easier for the elder folks because you don't have to do it on your own, full body, just going down. You just put a chair and just stand up from the chair repeatedly. You can put your arms crossed or extended for balance. And this is really going to help with quads, glutes, hips, and knees. There's some evidence that similar to the glute bridges, this type of exercise really improves the strength on your muscles and improves the capacity that you have to manage glucose and insulin. You just need to do something like 2 reps, 10 or 2 sets, or 10 to 12 reps and just can rest from 30 to 60 seconds between each one of those. What's your experience with this ones, Dr. Brewer?
So, as you know, that was in one of the videos that we did in terms of helping, especially those of us 60 and older, to understand where we stand. And I believe a major cut point was what, 10 to 12 chair squats in a
Yeah.
30-second period. Um, I'll brag a little bit and say I did 19, but then we had a bunch of people coming back saying they did like 30. And it's hard for me to to see how somebody could get up and back down in a second 30 times. But I'm sure they can. You know, we've got some really, really athletic folks watching, high performance folks watching the channel.
Yeah, and I can understand if you are a high performance senior, this might look too simple. But the reality is that most seniors are not in that position. Most seniors are dealing with back issues, knee issues, stuff like that. And some of these exercises might be good for them. This one might be a little bit harder for the knees compared to the other two. So you want to keep that on mind, but it's clearly going to help strengthen them. The key point is that if you are on your 60s, 70s, or 80s and you're not able to get up from the chair on your own, then there is a problem right there that we want to take care of.
You bring up a couple of good points. One has to do with disability, people that have knee and hip problems. What do we recommend for that? We got a lot of questions on that from a couple of those videos.
We'll have to take a closer look to the evidence-based ones because I always like to do that part of the evidence-based first before recommending, and we can go back to help with knees. I know for a fact that for most people, and this is not easy to do, but the best exercise for knee issues is definitely swimming. I know that some bicycle can be easy on the knees as well. I'm pretty sure you have more experience on that one.
I do, and again, I think that that's a hard question to answer because it really requires a little bit of problem solving. I'm going to put a plug in for what we're doing. You know, if you're interested in getting some help, some problem solving, some consultation, we're now set up to where you can do that. You can get a free consultation with us. At some point, if you'll show the number, isn't it like 859-721-1414?
Yes. Aspen can help with that.
Yeah, it's not that 300 number.
Yeah, exactly right.
Now, you bring up another point, though. We talked about that a minute ago. Why is all this focused on legs, knees, hips? Why are we not talking about curls and bench presses and all that stuff? Why are those not in here?
Well, those muscles are important, especially for aesthetics and cosmetics, and they will impact your metabolism. But clearly, at older ages and even younger ages, the biggest muscles are way more important. They have most of the capillaries where the insulin receptors lie, and they clearly impact metabolism a little bit more, way more.
And that's the whole thing. You know, we're looking at number one, impacting metabolism, and number two, keeping you from falling. So those two issues have to do with the leg muscles, calf, hip, thigh. Those are very important, both in terms of, again, being a metabolic tissue, as I discussed in the intro, and number two, keeping you from falling.
Yep. And just to go back to the knees, I believe if you do this once and maybe you get some support, like if you grab something or you just don't have like a very low chair, these can also help a little bit with the knees, just because it's the normal movement of knees. Now, if you have restricted movement from knees already because of arthritis or any other injuries, well, then yes, the range of motion is going to be reduced. For that, I believe the next one can be a really good option, which is the standing calf raises. And Dr. Brewer did a video where he was sharing how to do that on stairs. And even if you don't have a stair, you can even buy on Amazon or whatever some of those small steps, like they have 2 or 3 steps where you can go into, or even you can do them even if you're not really using stairs. Using stairs is a little bit better because you can go lower, right?
Yeah. So I think the research that you pulled on the on calf raises really went flat off the floor. I don't think it was even using stairs.
Yes, exactly. And the research Dr. Brewer is mentioning, we kind of did a rundown on the evidence behind all of these ones. The specific benefit on this one is that there's a study over there where they analyzed a bunch of people, like multiple studies, and it's like 200 yes, nearly 200 studies. Let me just get it here from you. And what they did find is that for those guys who went into this type of training, after a median of 5 years, the people who had the biggest calves, like every centimeter of extra calf diameter, translated into 5% less cardiovascular risk.
And
I
say
think
that
that
again, because if
for
you weren't listening, you might have just uh, skipped right over that. And that's something that people would not expect.
yes, so basically what they found was, for every centimeter of extra calf muscle diameter that we're measuring that with a measuring tape, you get less 5% less cardiovascular risk or less cardiovascular events. Like them, they measured that on those people, follow them over the years, and that's what they found out. I have the specific details on that study. Let me get them over here. They was just went right to my mind. I stopped with the benefits at the end.
So a
But if you want to,
30% decrease in cardiovascular risk from building your calf muscles. And we'll go back through these studies. I think we got a lot of geeks who want to hear and people from Missouri. If you don't know that term, I'm from Missouri, so I want to check it out. I don't believe you, the skeptical state. We've got a lot of people that are skeptics, and they want to hear the evidence. So we'll go back through the first three as well after we finish these last two exercises. These are all evidence based. They're not just a couple of guys sitting up there talking about what they think makes sense.
correct, and I have it right here. So we're going to put the links on the descriptions for you guys as well. Let me. I keep struggling with my mouse over here for some reason. It really messes up. Okay, so this is a 2022 meta-analysis published on the Journal of Nutrition and Health. 37 cohort studies, over 62,000 participants. That's the significance of the study, and that's what they found. They really identified those people who had the biggest calves versus the ones that haven't had the least on them. So the bigger your calf, the more muscle, the more active metabolism that you will have as well. Not to say that it's the calves only, but this is one of those exercises that really get neglected. All right. So what about grip strength? Isometric exercise yet again.
Look at the face on that guy. He watched me and watched Fred smoke me on that grip strength, and he's motivated. He's going to try to smoke me as well.
So and I remember you saying, yeah, I might just get more training onto this one just because I want to improve my score.
I want to
But it's
be
not
Fred. That's what I want to do.
but it's not just about strengthening your forearms. It's the effect that these type of exercise have. The glute bridges, the wall sits, and now the isometric hand grip training, they can decrease blood pressure up to 7 to 10 points in about 8 to 12 weeks as well. And you don't need to do kind of maximum effort every time. Using a dynamometer, like that's the device right there, it's a little bit better because you can do the highest contraction that you can do to see what's your 100% effort. But then the exercise, the contraction that you need to keep just to exercise it, just has to be like 30% of that. So that's why it's good to use a dynamometer, so you know how much you can get. Then to train it, you just do the 30%. If you can hold the contraction for up to 2 minutes, that will be the best, but I know it's a lot of time. So some people will do a little bit more grip strength, maybe 50%, even if they hold it for a shorter period of time. But just doing the stuff like that, a couple of sessions a week, maybe repeating that 4 times per session, 2 or 3 times a week, that's going to provide significant benefits, especially for blood pressure. You had an example with a dog bone, and we have a couple of videos on that. Want to talk a little bit about want to talk about that one a little bit further?
Sure. Before I do, I'll requote that research for you. Isometric holds. You know, we mentioned isometrics a few minutes ago, how they were discovered 50 years ago. Then they became passe because they didn't make you strong and quickly as strong as some of the other work, and they didn't help with health. Well, these things are getting a resurgence, and we're going to be referring to a couple of meta-analyses. For those of you who don't remember, a meta-analysis is a study of studies. In other words, you go back and you find studies that have been done on this area. So it's one of the highest levels of evidence because it's looking at all the places where this kind of evidence has been examined. And they found 7 to 12 millimeter of mercury decrease. Now, what does that mean? So if your blood pressure is 140 over 90, then they're finding that it's getting down to 133, even down to 128 with just like 8 to 10 weeks of isometric work. The diastolic, the number on the bottom, is decreasing 3 to 6. So again, if your diastolic started out at 90, 8 to 10 weeks of this kind of work, and now it's down to 87 or even 84. This is what you hope to get with medications. This is what doctors are looking to get when they put you on a med. So again, don't tell me that lifestyle is just sort of a nice to have and medications do the real work. Lifestyle will beat medications every day of the week. Now, I forgot what else you wanted me to talk about. I was going to talk about something else, but I went down this bunny hole.
The dog bone.
Oh, the dog bone. So I spent a decade of my life as the medical director for Toyota North America. And auto assembly is a whole lot of work like this. And so it stresses both the shoulders because, you know, our bodies don't appear to have been designed to do a lot of repetitive work with elbow over shoulder. But the other place where you get a lot of challenges in the automobile industry is in the hands. So those guys, the therapists, the physical therapists, the docs, the nurses that work in the automobile industry get really, really good at upper body therapy. One of the things I learned with him is a thing called a dog bone. And again, Jesus has some video of it. I don't have anything better to use. Maybe this. And pardon the bad model, but imagine this, and I've got one down in the garage that I made out of a broomstick. I just cut half the broomstick off. I got a piece of twine, string, thin rope. I taped it and tied it around the broomstick, and then I put about 10 pounds of weight down at the bottom, the other end of the rope. And what you do is you roll the weight up to here, and then you roll it back down. And what you're doing is major work in your forearms. And you see this fellow gritting his face, trying to improve his grip. That's mostly forearm work. Yes, there's a little bit of intrinsic hand muscle work going on as well, but major part of forearm work. Speaking of evidence, there's very significant evidence about grip strength work. And one of the things that most of our patients fear more than anything else, and me too, and that is cognitive decline. Very strong evidence indicating that you maintain good grip strength, you're going to maintain good cognition. Brain work. In other words, we're talking about avoiding Alzheimer's. Why does that connection exist? You know, I'm sure you'll hear people say they know why. Bottom line is we don't. We don't know why, but we do know that it exists. So I got three bunny holes there, not just one.
Fantastic. That's what people love to hear from you. So half an hour, and we were able to finish the bulk of the show. So basically, just as a summary, we're talking about glute bridges, wall sits or wall squats, talking about calf raises. We're talking about grip strength, isometric exercises, and chair squats. We understand that for some folks might be challenging to do some of these, especially I'm seeing comments on the wall seats can be dangerous. That's why we mentioned if you're going to do a wall seat, you might want to have something to hang on if it's necessary. But the reality is that just doing some of those exercises is going to be very, very significant. Even if you don't do all of them, just including some of them into your routine is going to be very important. And if you don't have a routine, I'll start with that. Start with creating an exercise routine for you. All right.
So
Yeah, go
before
ahead.
we go, I promised that we go back and look at the evidence. Glute
Sure.
bridge EMG study, electromyogram. It's an electronic measurement of muscles firing. Activates more than 60% of your maximal muscle capacity in those glutes, those butt muscles. That's enough to make real strength gains, and you get neuromuscular activation. It leads to better walking mechanics, leads to major fall prevention, and as we discussed before, in our area, it's a big, big deal for holding off, preventing a safety net for diabetes, metabolic disease, all those things that go with it, blindness, kidney disease, heart disease, strokes. The clinical evidence behind quad sets, or that wall sit, randomized clinical trial showing wall sits 3 times a week lowered systolic pressure by almost, systolic, that's the upper number, by almost 13 milligrams of mercury. Comparable to medications. Again, a very serious tool for heart health. Did we go over the chair squats?
Yeah, we mentioned increased insulin stimulated glucose.
Up to 40%
Uptake up
in
to
older
40%.
adults. The 30-second chair squat or stand test is one of the strongest predictors of long-term independence. Again, staying out of the nursing home. So, and then we get back to calf raises, and we talked about the evidence behind that. So, thank you for your patience.
Fantastic. So let's go answer some questions. We have a bunch of on them over here, and hopefully we're gonna be able to finish this show in less than an hour this time.
Well, now, are we going to show the water ball, or are we going to show Dr. Jesus's cracking, dissolving plaque image?
We haven't really used that one lately. I was hesitant of using that on the long form video, and I was thinking about we should use that after your introduction, but we really didn't come up to that one. Do you have any of those two ready, Aspen? Use whatever you have ready.
There we go. Get that plaque out of there.
I don't like the sound. It's like,
Yeah, the sound's not reality.
No, exactly.
But a great image.
Yeah, it goes a little bit too quick to my taste. We can fix it. Anyhow, pardon. We're here to share some knowledge, right? And learn with you guys as well. Just want to give a shout out to Rabitecha OP, just became a new member. Nick Karp, who just became a member, and Elena became a member as well. Your support goes a long way. Just a message to members. We answered your questions first in the live chat. We also have exclusive members videos that we were posting every Wednesday, but what we're going to do now is we're going to post just one video every month, but we're going to be covering more questions. Also on those exclusive members videos, expect to see more of our health coaches that are working with Dr. Brewer, Debbie, Jose, Bernardo, Andrea. I might convince Miranda to do one. One of the nurses, either Gina, Heather, all the people, smart people, professionals who are working with Dr. Brewer. If you become a patient, you will know them. But if you're a member, you also will see more of them. We're trying to put them on the screen as well. Next week, we're very likely going to be talking about statins with Dr. Bernie Mesa as well. So just expect for that. Thank you so much for being a member. That's kind of the benefits on that. And before we go to the next question, I know Dr. Brewer wanted me to not be so pushy on this one, but I also know that Fred wants me to do. So I need to find a balance on this one. Want to talk about this?
So yeah, again, popular demand. We're off, as you can tell, we're looking to offer more solutions to folks rather than just information. Getting your health back is, as you get into these 40s, 50s, sometimes teens and 20s, when we're talking about metabolic disease. By the time we're 18, everybody 18 and older, over half of us have metabolic disease. And so there's a bunch of different ways to deal with it. The biggest way is knowledge and discipline. So our channel started with providing a bunch of free knowledge. We got a lot of great feedback from it, and then people started asking for more. A few years ago, people started asking to be seen as patients. We started that. As we've mentioned a couple of times here, we're continuing to grow that program, and we have patients all over the world. At this point, we are at a place where we can offer a free consultation. So again, just go to that number that we talked about before. We're also offering some other things as well. We're planning what's called a digital twin. It's just hopefully a twin of me. It's a digital twin. And Jesus and Miranda, Fred, and I were working with Bill, who's helping us build it. And there's challenges on it. We had hoped to already get this thing out. It's a thing where you have, Jesus and me in your pocket. You pull it out and you ask it a question and it answers it. Now, it's not answering it quite correctly yet. So we don't want to put something out. And we do expect when we do put it out, especially for beta testing, there will be some challenges with it. But it's not ready for prime time yet. It requires some more work. And especially Jesus and Miranda and I right now are putting a lot of time into getting it better before we make it available to folks. But that would be a great way, to have basically an AI trained for our science, our knowledge right there in your pocket. So it's called a pull. Anytime you want to pull it, not so much waiting for us to push it to you, you pull it anytime you want. Supplements. So, we're talking about the different ways to improve your health. Behavior is a big deal. Medications are important. You can get those through the medical services that we offer. Information, obviously, the biggest deal. You get that through the channel. You'll get that through the digital twin. And now we're also offering supplements. And their supplements are, as we said, lifestyle's number one. Medications and supplements are further back, but they can be important, especially in a lot of different places. One of the places that we talked about one of the most important supplements for seniors a few weeks ago in a video. It was on creatine. And what happened was we got a landslide. We got close to 100 requests for creatine in a day. And we ran out, and we're still trying to catch up with supplies for creatine. So we think we're there now to meet the demand. But again, as Jesus is showing you, a lot of people don't even know that we're offering supplements yet. Those are available. Anything else I need to share about that? I can't hear you, Jesus. I doubt anybody else can either, because you're on mute.
There was a train passing by, so I had to mute myself. So I was saying, way to sell you out, Dr. Brewer. You are here just for the money, right?
That's exactly right. Just a gold digger.
Now,
I will tell you this: had I gone into surgical and procedures-based medicine, I would have made 40 years ago. I would have made a ton. I would have made a lot of money. but you wouldn't have really impacted that many lives. And even the lives that you impact with surgical procedures often end up back in the same place. You know, some of the people that we know on YouTube, Peter Attia, you know, he did most of his training in surgery at Hopkins, then realized that's not really the way to change lives. Casey Means, oh, she got pummeled when she got proposed for a high level position because she got all the way through, except for a few months in her surgical residency training, and then had that moment of truth that procedures are not helping. I started from the very beginning feeling like medicine's way too much about procedures, making money for docs, and not enough about keeping people healthy.
Yeah.
So that's where we are. That's where I've been from the beginning.
So just to go to the questions, because we have plenty of stuff free for folks, free content on YouTube. We want to answer your questions, as many as we can, and I think we just went too long. But the 3-4 services that we're providing, all of them are targeting to help you out. And as Dr. Brewer said before talking about this, there's no medication, there's no supplement that's going to be the healthy lifestyle. And that's why we're offering those free consultations. If you're looking to become a patient and want to have a taste of what that would be and how to get a personalized care, call 859-721-1414. 1414. And that's going to be, put the number over there, Aspen, please, just one more time. And that's going to be for you to see if this is something that will fit you. Just the phone number, please. We started getting questions. No, the other one, 859-721-1414. And we started getting calls from people like, hey, what do you think about peptides? What do you think about this? What do you think about that? That's not a hotline. That's what we're developing, that AI bot that will answer just like Dr. Brew would answer. When that's ready, we're going to let you know, guys. And that's going to be very, very cheap, I believe. Anyhow, enough. Let's go to questions now. Good morning to all of our members and all of our non-members as well. Keith Lawson, good morning from Arizona. JD, Richard Militello, Bama J, who I also believe doesn't miss any of the things that we put out. Thank you so much, from Alabama. Just want to shout out a couple of them, even if they're not members. Claudia Parascandola, Paris, France, fantastic. Let me see if I can find just a quick question over here. On Dr. Brewer's recommendation, I'm now taking 3 to 5 milligrams a day, 5 times a week of creatine now for 3 weeks. Fantastic. Let us know, how is it going? We saw some people saying, oh, creatine didn't really help me out. My doctor said I should not be taking it, that I'm going to lose my hair. We went through all of the evidence, and we're pretty sure if there is any evidence of that, is really, really weak. Creatine is probably one of the safest supplements out there.
So if you don't mind, Jesus, I'd like to deal with this one because it's so important.
Please go ahead.
Ed L., sorry for the comment, but the supplements offered are pricey compared to the market. Yes, they are. And we're just not in a bargain basement market on supplements. We're not going to be doing that. When I first started realizing that supplements have a place and can actually work, I did what I usually do. I started checking for bargains, and I ended up with finding out that a couple of the supplements that I was using, one was from China, which, you know, you've heard of this before probably, had a bunch of stuff in it that I really did not need. It was not good for my health. So at the end of the day, we're not going to be a bargain provider for supplements. We're not going to be bargain basement. Our focus is going to be getting the highest quality supplement that you can get in that category. Sometimes you're going to pay a little bit more, and if you want to get a bargain, you may want to look at a different source. From our perspective, getting better health is the bargain. It is. I mean, it's like I don't think we have to go too deep in terms of saying your time is the most important, precious thing that you have. And so that's where we're going to be focusing: quality and health as opposed to bargains.
Yeah, and at the end, we preach lifestyle. So we understand if those can be a little bit pricey. We're working with a high quality company that's doing that, US based, and everything is US based. So that's the thing. Uh, Ruben O, will you notice a decrease in your blood calcium levels in lab tests after taking K2 for a few months? I think that's kind of the one of the biggest misconceptions with K2, isn't it, Dr. Brewer? Like the theoretical, it says takes out calcium from the arteries, puts it on the bone. But the reality is that if there's one hormone that really manages calcium levels, that's parathyroid hormone, not
Yeah.
really K2. The
Right.
blood calcium levels really do not reflect if that's really helping your arteries or not. That's the same thing that people saying, hey, taking more calcium will impact arteries calcification. Not really, although there is some evidence about dangers of calcium supplementation that we can cover on another video. Um, the levels of calcium within the blood have to do more with parathyroid hormone rather than anything else.
Yeah, and there's that. I think there's with any of these topics, you see multiple levels of understanding or misunderstanding, and I think the misunderstanding here is, well, if it takes it out of the arteries, it's taking it out of the bloodstream too, and no, it's not taking it out of the calcium. It's not lowering calcium in the blood. What the perception and the thought and the general consideration is that it takes it out of the tissue of the arteries. In other words, a calcium score. Theoretically, those people that say that would say that vitamin K2 would lower a calcium score. I have never seen evidence of a significant lowering of a calcium score, but here's what it does appear to do. We know that it impacts a couple of enzymes, osteocalcin and matrix GLA protein, for the geeks out there that want to look it up. And those enzymes both have to do with calcium in our tissues. Osteocalcin, in terms of putting calcium in the bone, and matrix GLA protein in terms of taking calcium out of the soft tissue of the artery wall. So there are connections there. And those two, by the way, here's where I think the real connection is, and it's not discussed very much yet, but there's research going on in that area. And that is, both of those enzymes seem to be very much linked to, their performance seems to be linked to metabolic disease. So if they're working well, you probably don't have metabolic disease. If they're not working, you probably do. What the connection is, we don't know. But I'm not the only person noticing that. There are a couple of studies out there that have been done that showed some improvement in metabolic disease in middle-aged men, taking about 300 to 400 micrograms of vitamin K2 daily. That gets into some of our discussions and one of our recent videos. I had a patient ask me about, well, you mean you shouldn't take vitamin D3 and K2 at the same time? Not technically what we said, and maybe we created some confusion there when we did it. What we're saying is, don't take the same combination that you tend to get in these combination pills. You'll see these combination pills that have 5,000 international units of vitamin D3 and 100 micrograms of K2. That's not really a good combination. You need to look at each of these separately and get the proper dose.
Yeah, and there's also the conversation, and I appreciate you highlighting that. There's also a conversation about calcium in arteries and people saying K2 might reverse calcium score, and how good that is. If you really need to look for reversing your calcium score, and the one thing that I know about that and the evidence is that it really doesn't reverse it, but there are some studies that show that it can slow the progression of it. Now, how much do you want that? Like, if you think that calcified arteries are a problem, I think they could be on the context of poor metabolic health. In the context of good metabolic health, a little bit of calcium or calcifying arteries might be just going towards the road of stabilizing that plaque and avoiding it ruptures. So there is always a bunch of nuances, and it depends in there. Richard Militello, what is a good source for natto? Well, natto is the dish, isn't it? So I guess Richard is referring to the natto kinase.
Pardon the terminology, but it's the rotten soybean dish. Mm-hmm, mm-hmm. Speaking of patients, I talked to a patient yesterday who said, hey, by the way, I am eating natto every day now. And I went, wait a minute, taking natto powder? Nope, I'm eating natto, fermented soybeans. And I thought, well, that's impressive. She said, yeah, it took me a while to get wrap my taste buds around that, but I'm okay with it now.
So have you gone through the bunny hole of how to make it at home?
I
I haven't.
haven't.
I haven't.
I've never made it. So I
Yeah.
doubt that I'm ever going to make fermented soybeans.
Back in the day, I used to eat a lot of bean soup. You might not be surprised of that. And I was in a phase where I was putting lime. You call it lime. I call it lemon on everything. And I bet that natto might taste somewhere closer to that. Putting some lime into bean soup.
Oh,
Anyhow,
so you've never had true natto?
no, no. I should probably taste it whenever I have a chance. I
It
Jake,
tastes a little bit. It doesn't have that kind of citrus tang. It's got more of a rotten bean taste
yeah,
because it's a rotten bean. That's why. But it's good for you.
yeah. It's impressive, right? You might think it is not, but of course that's why I'm asking about the process, how to make it, just to be sure that it's fermented the right way. JD, I just tried the wall sit and it is very challenging for 15 seconds. Yeah.
Yeah,
I actually recommend people who are doing leg work, you might want to start your leg work with that. Of course, you do some stretching first and then try to do that one first.
it only
Uh,
takes a minute, assuming you can even get there.
yeah, and if you do 15 seconds, that's better. You're gonna get there.
Good
Uh,
place to start.
JD just finished another rep of the wall sit, a little bit easier now. Exactly that. You gotta get some heat in there. Seated calf raises at the gym, of course. Less pressure on the back. Yeah. And if you do it with some weights and stuff, yeah. And 1 centimeter on your calf is a lot. Yes. I think there's some genetic components of that as well. Like from my time being playing soccer, I really developed some good calves. Uh, and I haven't lost them. Uh, but tights can be a little bit challenger, more challenge. How far should how far up should one push on the glute bridge? That's a good question. So the key is, and I don't know, Aspen, if you got that image from Dr. Brewer, but the key is, if you are flat on your back, put your knees on a 90-degree angle. Well, not 90-degree angle, but it's just like your legs are like that, your calves are like this. Yeah, exactly. Thank you so much. So the image is like you connect your abdomen to the tip of your knees. You create that angle, so you don't need to go over that, and you don't need to be like too down either. So I think that's a good example of where you should be. And once you're into that position, the key is that you are voluntarily pushing into your abdomen and your glutes. So you press on that yourself, and that's where you start to feel it. So it's not the most common mistake is putting your hip too high. You don't need to do that. Just align them with your knees.
Jesus, I know you're trying to hit under an hour. I've got three things I want to cover.
Go ahead.
Uh, One is Aspen. If you'll take a look at what I just sent you, that's one of them. So you can start getting that image ready. Another thing I wanted to mention briefly, again, JMK is always bringing up some good topics. More young physicians would consider functional metabolic medicine if there were more incentives provided by big insurance and big government. You know, I used to work for a company that was very big into Medicare Advantage. And I was a big fan because Medicare Advantage was a way that they were actually rewarding doctors for good prevention. It started out as an experiment. It started to work. Docs started doing well. They started getting rewarded for it. The owner of the company that I worked for was a fellow named Sid Pagadapati. He's a well-known, very wealthy gentleman. His dad, Dr. Pagadapati, had started this Medicare Advantage program and was very successful in preventing disease for years. Medicare Advantage became well known for saving dollars. As any big project like that, there were issues. One of the issues recently is that some doctors were successfully making too much money. And so now they backed way off. We did it before they did that. We started going into Medicare to do Medicare Advantage for our patients. And then Medicare just made some changes where they just, it was not financially viable anymore. So you're right, JMK. There are ways that insurance companies could actually make prevention work. It's already been proven, but now it's back being chopped up again. So much for that.
And also, just to give you kind of a scary statistic on the reality of healthcare, not only in the U.S., and I think this is very similar in Mexico as well. What percentage of doctors actually go into learning preventive medicine?
Well, I ran the preventive medicine program at Johns Hopkins for years, and it was well known at that point in time. 1 out of 300 at that point in time, and it's probably less now. So it's like, and guess what? Out of that 1 out of 300, over 90% didn't go into this kind of preventive medicine. They just went to work for the government.
Well,
which again,
yeah. And well, let me know. Let me give you some recent data, because I think that was back in your day. Right now, it says that it's about 0.8% of U.S. physicians are board certified in preventive medicine. That's 1 out of 100. You're one of those 0.8%, by the way.
Yeah.
Yeah, and I agree with you. Preventive medicine is very similar in Mexico. Like, there's very few. Like, I think there are like 2 spots a year or something like that, and they end up working for the government rather than creating spaces like this.
Aspen, were you able to get to those images yet?
Well, while Aspen gets that image, Dr. Burris is the man.
Oh, wait a minute. Is that Dr. Jesus 20 years from now? Look at that.
Oh, man, look at that. That's AI, isn't it?
No, that's Benicio del Toro.
Benicio del Toro.
But wait a minute. When it shows you and him, it's hard to tell which is which.
Well, I need to fix my hair, though.
There you go. So one last thing, with my last comment before we go, Jill King, I really appreciate Dr. Brewer's Metabomega, and it's packaged in glass, not plastic. Yep, that's a big deal. Could you please discuss Metabomega and what we put into it? So we don't have time today and still meet Dr. Dr. Vega's goal of getting out in an hour. But what we will do is bring on Miranda. She's managing a lot of our supplements program, and we need to get her on the channel to talk a little bit more about that as well.
Yeah, it's about the quality as well. And we recognize probably the pricing, but it's about the quality. It's nothing else, and it's US based. You can get cheaper stuff that's coming from abroad. I know. So, but at the end, the supplement is secondary. The main key is what you're doing with your lifestyle today. Yep. I appreciate that. And I never been called like that.
Benicio del Toro Jr.
Yeah. AI brackets. Are farmers carries good for grip strength? How about dead hangs?
Both are. Yeah, both are very good.
Fantastic.
We got to go.
Just let me go on one more question. I want to make sure that I am addressing some of these. Wrist grips exercise with weights using a barbell by rotating the barbell and the figures back and forward, increase weight time. There are some specific barbells made for that. Dog bones. If you look for grip strength trainers, you're going to have that. Find those wherever you want to buy them. And that's it. Well, Dr. Brewer, thank you so much for keeping me on time then. If we didn't reach out to your question, we apologize. We'll be sure to get to it the next time. All right.
Thank you much.
Thank you very much.
Thank you for your interest. Are we going to end it? I can't. Here we go.
I can help you.